All right, I'm gonna do a little demonstration around feeding, burping, and what to do if your baby spits up. So when you are buying bottles, don't buy too many in the beginning because you might need to do some troubleshooting to see what works for your baby. Whenever you're feeding your baby, make sure that you're paying attention and watching and never prop the bottle up with anything. That way you can see if your baby gags or chokes or spits or anything happens during the feed, you can react very quickly. So with the nipple, which is this top part that gets screwed onto the bottle, there's different shapes that it comes in. So if your baby's making a lot of smacking noises and having trouble getting a good seal around the nipple, you might need to try a different shape. There's different flows as well. So if you feel like if it's coming out too fast for them and they're choking on it, you might need a slower flow nipple. You can also try adjusting the angle. So instead of feeding them like this, you can try to feed them more at this angle and see if they're able to pace their feeding on their own a little bit better. But if that still doesn't work, you might need a slower flow nipple, which means that the hole at the end is a little bit slower. On the other end, if your baby is taking more than about 30 minutes to eat and it seems like they're working really hard just to get through the feeding, you might need a faster flow and have the breast milk or formula come out of the bottle a little bit quicker so that they can not work so hard to finish their feeding. So once they're nice and full and done eating, you're gonna want to burp them. Some babies will also need to be burped in the middle of a feed. So if they're really gassy and they're spitting up a lot, try increasing the amount that you're burping them and burp them mid-feed and at the end, but at least always at the end. And when your baby gets a little bit older, you're probably gonna do the over-the-shoulder technique. So this is probably the one you've seen the most, where the back is nice and straight, head is a little bit turned to the side so they can breathe, and you just pat their back like this. But when they're a newborn, this is kind of a tough position because sometimes they just curl down. They don't have a lot of muscle yet, so they can be a little roly-polies. So I'm gonna show you another position that's a little bit better for newborns. The first few days, it might be really difficult to get any burps out, but it's still important that you burp them. You will get those nice juicy burps once they get a little bit bigger, their stomach gets bigger, and they're taking more volume in. So with your newborn sitting in your lap, you're going to just lean them forward onto your other hand, and my hand is in a V shape, and most of their weight is actually against my palm, so kind of chest to palm, and then you're making a V shape and your thumb and forefinger are supporting the bones of their jaw. So they're kind of leaning like this in a sitting position, and then you're patting their back. And I would highly recommend adding a burp cloth because sometimes things will come out. So same position, just wrapping that cloth around your hand and leaning them forward like this. And when you pat them, make sure that you're patting hard enough that you can hear it. So a nice audible drum beat. A lot of new parents just go really soft, and if you can't hear anything, probably not gonna knock that air bubble out. So of course, we're not going super hard, but just enough so you can hear a nice drum beat. So you want their back to be nice and straight. If you're having trouble getting the burp out, one little tip I have is try just flipping them around. So just pick them up, turn them around the other way, and try the same thing. Another tip to get that burp out is you can try just with both hands supporting them, just kind of rotate them around a few times and see if that gets the air bubble to come up, and then start patting again and see if that gets the burp to come out. And once they're done burping, I would highly recommend not just setting them right back down in their crib. Imagine eating a big meal and then laying right down in your bed. You're probably gonna feel some things coming up. So just hold your baby in whatever position is comfortable for you. And it's a really nice opportunity to enjoy a nice full baby and have some bonding time. And so just hold them for a good 5 to 10 minutes before setting them back down in their crib in a swaddle, ready for their next sleep cycle. So babies do spit up from time to time, and that is completely normal. However, if your baby's having projectile vomiting, that is not normal, and you definitely want to call your pediatrician about that. But if you do see your baby spitting up in the crib when they're lying down, I would do exactly what I just showed you, just burp them as quickly as possible. And so what I would do is just put my hand under them, sit them up in their crib like this, and just start patting their back. And if they were struggling, I might pat a little bit harder just so gravity can help get what is ever in their mouth to come out. they might start crying, and then I might just rub their back as they recover from that, and then just hold them for a little bit before setting them back down. All right, so that's it for feeding, burping, and spit up.